exactly what we hope this dialogue strengthens. With this, let's move to our first speaker. I'm delighted to introduce Ms. Ewinur Machdar of the International Federation of Red Cross and Red Crescent Societies. She will share how humanitarian action embeds dignity, safety, and well-being into sanitation systems, drawing from her experience reaching some of the world's most at-risk communities. Ms. Evie is a seasoned humanitarian and development professional with over 24 years of experience across Asia, the Pacific, and Africa. An environmental engineer with a Master of Science from the IIT Delft Institute for Water Education in the Netherlands, she brings strong technical and coordination expertise in WASH sector. She has contributed to major humanitarian responses, including the 2004 Indian Ocean tsunami, the 2015 Nepal earthquake, and the 2018 Rohingya refugee crisis. Currently, Ms. Evie serves as the IFRC Regional Asia-Pacific WASH Coordinator, overseeing initiatives across 38 countries and leading efforts to strengthen water security, emergency response, and regional partnerships from her base in Jakarta, Indonesia. So my question to you, Ms. Evie, is how can applying the protection, gender, and inclusion, or the PGI approach, guided by IFRC's 4 principles of TAPS, that's dignity, access, participation, and safety, move us beyond standard toilets and water points toward WASH systems that protect, include, and benefit everyone, even in emergencies and long-term sustainable development. So with this, I hand it over to you, Ms. Evie.
Thank you, Dr. Vinita. And then I'm happy to be here. It's such an honor to be here. I will answer your questions through the presentations. And then if not really answering the questions, we can walk back and then discussing more about this, our approach in terms of our guiding principle in PGI into WASH. And then for the time being, during the presentations, I will turn off my camera, if that's okay. And then after that, I will turn it on again. And I will share my screen. Let me wait. And please confirm, you can see my screen now?
Yes, we can see your screen.
Okay. So thank you again, Dr. Vinita, and then the organizer of these important sessions. Again, like this is really important, like how we going to discuss and then share about IFRC approach in terms of inclusive sanitations in here, and then it's beyond the facility, beyond the infrastructures. So we will walk through our approach and some example from our experience in the field, mostly from the humanitarian operations. And then feel free to put your question.
Excuse me, Ms. Evie, can you change the presenter mode?
Yes, I put it on the presentation mode, but wait, let me stop the. It's not on presentations mode, so
No.
wait. How about now?
Not yet.
How about now?
Okay, yes, it's working.
Okay.
Perfect.
Okay, thank you. So yeah, so where were I? So yeah, so we'll walk through like the approach and also from the field experience. And I don't think I need to introduce myself because thanks to Dr. Pineta already like introduced myself earlier. But again, I'm not really sure how the audience familiar with the IFRC. So just to give you a little bit of glance, what is IFRC? IFRC, the International Federation of Red Cross and Red Crescent Societies, is the world's largest humanitarian network. It brings together 191 national societies working to save lives, strengthen local actions, build resilience communities, and promote dignity. The IFRC Asia Pacific region includes 38 national societies, so it's quite diverse from Afghanistan in the west to the Samoa and Tonga in the east. This region is highly diverse and also one of the most disaster-prone areas in the world, making IFRC support really critical not only to our national society, but also to the countries that within this region. Safe sanitation is essential. It protects our health, our dignity, and even our environment. But despite the progress made globally, billions of people still don't have access to this basic right. According to UNICEF 2025 SDG monitoring data, 2 out of every 5 people, about 3.4 billion individuals, still lack safely managed sanitation services. And in the Pacific alone, which is part of our region, 9 million people still live without access to basic sanitations. So what does this mean in real life? Without safe sanitations, communities face higher disease risk, greater safety concern, and increased vulnerability, especially for vulnerable groups like women and girls, people with disability, and also elderly. This is why strengthening safe, inclusive sanitation is so critical everywhere. When we talk about WASH, water, sanitation, and hygiene, we're talking about the essential of life. These services are key to people's health, dignity, and overall well-being, as I mentioned earlier. Access to WASH is human right, and when our programs are inclusive, protective, and gender-sensitive, we create safer and more equitable outcomes for everyone. By planning and designing WASH services in ways that reduce discriminations and the risk of violence, and by ensuring meaningful participation in all groups, we can meet the diverse needs of every person in the community and truly leave no one behind. So, how we actually do this in IFRC and with our national society? So when we talk about the IFRC approach to inclusive WASH of water sanitation and hygiene, we're really talking about moving away from a one-size-fits-all model and shifting towards people-centered WASH. We use 4 key principles as based on the questions earlier of Dr. Pinita. It's dignity, access, participations, and safety, or DAPS. This guide everything we do in WASH to make sure protections, gender, and inclusion are really at the center. So let's go through all these 4 principles. Let's start with dignity. So dignity means making sure everyone can manage their personal and household hygiene in a way that feels private, comfortable, and culturally appropriate. People need enough water, safe space for their water and toilet, and the right facilities so they can take care of themselves with confidence. The second one is access. Access means WASH service and information are designed so everyone can use them and benefit from them. We consider gender, age, disability, and cultural norms to make sure no one is excluded or disadvantaged from the facility or services. The next one is participations. Participations mean making sure everyone, women, men, youth, elderly, and people with disability, and also all those minority group, can share their views and help make decisions about their needs in terms of WASH facilities. When people are involved from the start, the solutions work better for everyone. Safety means WASH facilities are designed and located so people can use them without fear or risk. This includes ensuring privacy, reducing overcrowding, improving lighting, and addressing any conditions that might expose people to violence, especially in emergencies. So, how do we do it in practical? So, for example, it's quite easy, which is it's really integrated in our day-to-day program and activities. So, we make sure that we hire diverse and balanced WASH teams, both gender, the ethnic group, the cultural background. So make sure we have balanced and diverse WASH teams in our program. Collect data disaggregated by sex, age, and disability. Ensure all groups have meaningful participation in decision-making process. Continuously analyze the specific needs, preference, capacities, barrier to access, and safety risks related to WASH infrastructures and activities for each group. Revise and adjust activities focusing on doing no harm and leaving no one behind. So this is really important to revise and adjust activities because needs are changed, situations are changed. So that's why we really need to revise and adjust the approach. To integrate protections and gender inclusions into WASH program cycle in IFRC, we use what we call the 8 steps approach, as you can see from the slide. So this is help us to continuously check and adjust our work to ensure dignity, access, participation, and safety for everyone applied. So, for example, as you can see from the slides, this is one of the example how we review and readjust our approach in terms of like installations of lights in community latrines in a camp. During the assessment, the team found that the latrine area was very dark at night and women and girls were afraid to use it. So based on that assessment, the team agreed to plan and install the lights around the latrines. But when monitoring the situations, the team discovered the problem wasn't fully solved. The lit area had become gathering spot for men because that's the only area with the lights, for example. And then most of the area of the camp is quite dark. So the area with the light is attracting more people together, and then it's increased risk for women, and then it's make a woman didn't feel safe to walk past them and to reach the latrines. So based on that monitoring, so the team reviewed situations and held another FGD and round of consultations with the community, including the men in here. So based on that discussions, the men suggested to install another lights in another area where they could gather. So the team agreed on this approach to edit the lighting in different parts of the camp, and then the men will gather in that area. With this review and readjust, so the men is no longer gathered around the latrines, and women and girls finally felt safe using the latrines at night. So this is also give another important reminder. So we need to support at-risk group, but not in a way that leave other feeling excluded. In this case, for example, feeling the man is not included in this approach. If people don't understand why certain group receive specific support, it can lead to frustrations, misuse of facilities, or lack of cooperations. That's why open dialogue is essential to explaining. For example, why women need light in their toilet, or why people with disability need more accessible latrines. When everyone understands the purpose, they feel respected and stay engaged in WASH program. Another example in here, how we implement DAPS in practice. For example, how we use this set of questions, guiding questions and checklists, how to put the PGI lenses into WASH programming. There's a set of questions, and then we just check whether we already integrated those perspectives in WASH programming. Just for examples, how we integrated SADD or sex, age, disaggregated data in our indicator, baseline data, reporting, and all those kind of related informations. Because this is really important, because our approach should be targeted based on the needs and the situations, because everyone is unique and they have their own needs. And also, for example, this is also important when we discuss collecting data about disability, it should be also disaggregated by the functions, like walking, seeing, hearing, cognition, self-care, and communications, because every disability or every functions have a different approach in terms of access, in terms of informations they prefer. So this is really important how we design our approach to the community. So this is the example that I would like to share based on our emergency operations in one of the camp in Asia Pacific. So I would like to highlight in here, it is important to remember that barriers to access sanitation facilities or WASH facilities in general are not only about gender and physical disability. Many people can face multiple or overlapping challenges that make them really hard to access water and sanitation facilities. For example, as per these pictures, like we can see, the latrine is constructed quite uphill, and then there's a people with a limited movement face difficulty to access the toilet. So imagine if these elderly people with disability, and then this person came from minority group, he struggles to reach the latrines because of the path is unsafe and it's uphill. And so he uses a bucket at home, something he finds embarrassing because he can't empty it himself. He has an idea how to improve the situations, but people from his community, which is the minority, aren't included in the WASH committee, wasn't included in the discussions. So he also has trouble hearing during the group discussions, and written information isn't in a language he understands. So this is really showing how these multiple barriers can exclude someone in many ways. That is why in our programming in IFRC and also national society, we also try as much as possible to reach like the last mile, to try to really meet all these people in every corner of the camp, in every corner of the community, to make sure, again, leave no one behind and make sure like everyone's like we listen to everyone and everyone is included. And also another example that like to make sure and to ensure that the toilet facilities for women are safe and dignified. In IFRC, we use a minimum standard design, as you can see from the slides that I shared in here. Like this is the minimum standard that we use like for woman-friendly toilet. This design provides a clear baseline and can then be adapted to fit the local context, which I can show it later how it's adapting to the local context during some of emergency response. I'm not going into detail of this checklist, but the highlight in this one is actually to ensure privacy, safety and security of the user group, and also with the clear sign. You can find out more detail about this standard to the resources that I will share later as a reference if you're interested. So how we put that design in practice. So as you can see, this is like some few example that how we implement during our emergency operations in some of the camps in Bangladesh, for example. So this is the first two pictures actually from same latrines. You can see there's a hole in the wall. As you can see, there's a hole in the wall there that's like connected to the down pipe outside, and then later on connected to some kind of a collecting point. So this is the design is actually for like a menstrual friendly toilet. When the user group in this community, they can dispose their pads straight to the downpipe without anyone seeing that one. So it's also like it's for their dignity as well. So the third pictures, this is the one with the bamboo and then the tarpaulin. So this latrine is located at the main pathway or access road in the camp. So there's a lot of passerby in that area. So women group in that the one that using this latrine, they felt unsafe and then insecure because there's many people passing the latrines, and then they felt like everyone's watching them when they're going to the toilet. So during the review and readjust after the monitoring, our team discussed with the community what is their recommendation, how to approach the situations. So what they propose is actually like to put like simple barrier, like a simple bamboo shield like this with the tarpaulins, and then to change the doors like to different directions. So this simple approach and then modifications also help the community, specifically for this case, like women feel safe, and then make them like feel comfortable to use the latrines. And the last one, this one is also for from another camp, which is this one is from this one is for latrines for pregnant women. In this community, even though they're pregnant, they still prefer to squat at some extent. But however, they request they need some kind of handrail in this one, and then based on the discussions, we modified the latrines with handheld made of the bamboo. So this is really like simple improvement, but also help the community access the toilet and also make them also feel safety. And this is not only for the pregnant woman, but also can be used for people with disability, and then also with children, for examples. So we're approaching to the end of my session. So the key message is what I would like to share in here. There is no one size fits all solutions for sanitations, specifically in here. People have different needs, and our services must reflect that. we must shift from just responding to the needs to a human right approach, which means like we really need to listen to them. Water, sanitation, and hygiene are basic rights for everyone. And equity means adjusting our services to that everyone, regardless of their situations, can access the same opportunities. Ensuring equal opportunities and non-discriminations is a core human right and central of inclusive WASH. And then the last one, this is some of the resources that we are using with our network in IFRC, and it's also accessible publicly for everyone as a reference. As you can see, in addition to like PGI and WASH guidelines, we also have like another learning from our national society globally, not only from Asia Pacific, but also some kind of like the inclusive WASH design, and also like access to our portal washifrc.org.